Now that the weather is turning warmer, a lot of people are getting back outside for activities like running and cycling. And you or someone you know may be setting their sights on attempting a race. Whether it's a 5K, a marathon, or even a triathlon, training properly is key. So how do you train for a big race? For expert advice, we want to welcome Dr. Jefferey Michaelson, an orthopedic surgeon with our sponsor, the Core Institute. Thank you for being with us this morning.
Thanks, Heidi. Thanks for having me.
So what should people keep in mind even before they rev up their running and cycling routines?
So this is like a really fun time of year for all of us, because I think what's happening is we're kind of coming out of hibernation and people are excited to see the sun. I know my neighborhood's starting to see all of the people out walking their dogs. And this is when people really start setting new goals for ourselves in terms of trying to do something different, maybe something harder or something bigger. So I think the most important thing when we talk about training for a race, whether it's a 5K or a couch to 5K or trying to do an Ironman triathlon, is understanding that the time to improve and the time to get better really is about, incremental changes and thinking about doing this as setting goals and trying to balance themselves out. And by balance, usually what I mean by that is trying to play a little bit of, if you're setting a goal for a running race, still trying to do some stretching, trying to do some strength training, trying to do some balance training, because trying to go and do it all in a week generally is a setup for failure, and that's usually when people are knocking on my door.
Yeah, isn't that the truth? So what is a good way to train to help avoid injuries? Obviously, like you said, starting slow.
So I think starting slow is one of the things, but trying to understand that training for a longer race is about what we say, time under load. So there's speed changes and there's load changes. And what I mean by that is trying to go from I've never run before to running 13 miles isn't something that's going to happen. So your first week, you want to maybe set a goal of I want to run 3 days a week. I'd like to see myself increasing a little bit of speed work. I'm always a really big fan of cross training. Myself, I'm a triathlete, so I know that for me, trying to train for a triathlon is always about balancing a little bit of biking, a little bit of running, a little bit of strength, and it keeps me healthy, and it keeps me out of the injury category over the longer haul.
Right.
So I think that's probably really the best thing, is understanding that a good health program isn't just about training singularly for a single event, but trying to balance out strength, balance, and endurance.
All right. Now, what are some of the most common types of injuries?
So with the runners, I would say probably if you're new to running, the big thing we'll see is the what we say anterior knee pain, something called runner's knee. Fancy word for runner's knee is something called chondromalacia patella. The kneecap is the patella. That's probably the biggie. And then the other is we'll see a lot of people getting out who haven't really been stretching and are trying to get back into a running routine, where they're finding themselves having some foot and ankle pain, a lot of Achilles pain, calf pain. Those are really the biggies.
All right. Now, how can the Core Institute help with these injuries?
So this is, I think, most important is I am an orthopedic surgeon, and I think people get a little bit nervous about coming to see us. I think the most important thing, and especially our philosophy at the Core Institute, is our job as orthopedic doctors, as sports doctors, is to help you get to the start line. People really need to think of themselves as athletes the minute you set a goal and you start working towards getting yourself there. And our goal is to get you there. So sometimes that means surgery, but that's not very often. And what I think is most important is letting us evaluate you and help you get to the starting line in those goals. Don't be afraid of seeing the orthopedic surgeon, because we're probably not going to tell you operate. We're going to talk about understanding what those goals are and trying to help you understand through a therapy program, through a strength program, through a flexibility program, how do you try and achieve those goals.
Okay, great information. Thank you for joining us, Dr. Michaelson.
Thank you, Tati. Thanks for having me.
To learn more about how the Core Institute could help you in your life in motion, and to find the location nearest you, visit their website, thecoreinstitute.com.